And good morning or good afternoon, wherever you might be. This is Pete Peterson coming to you live here from the Dean's Conference Room at Pepperdine's Graduate School of Public Policy. Delighted to welcome you here to our next policy webinar, Are There Creative Solutions to Homelessness? With Dr. Stephen Eide from the Manhattan Institute. Before I introduce Stephen and our conversation for today, just a quick discussion about overview of our agenda. As is usually the case with these policy-related webinars, we're going to begin with introductory and table-setting remarks by Dr. Eide. Those will happen over the course of our first 15 or 20 minutes together. Then I'll engage Dr. Eide in conversation for about 10 or 15 minutes, and then we welcome your questions. Would be hard to think that any of us are unfamiliar with this Zoom platform at this point, but we are entertaining questions through the chat feature, which you'll see down at the bottom of your screen at any point during our conversation. If you have a question you'd like to pose to Dr. Eide, simply click on the chat icon, enter that question, and we'll get to those toward the end of our time together. I know we've got a lot of registrations here for today. I know some will be joining us live and others have registered in order to get the link to the recording, which we will be sending out to all of our registrations within 24 hours of the conclusion of our time here together. A little bit about our speaker today. Dr. Stephen Eide is a senior fellow at the Manhattan Institute and a contributing editor there of their city journal. He researches state and local finance and social policy questions such as homelessness, our topic for today, and related mental illness. He has written for many publications, including National Review, New York Daily News, the New York Post, New York Times, Politico, Wall Street Journal, and the Weekly Standard. He was previously a senior research associate at the Worcester Regional Research Bureau. He holds a BA from St. John's College in Santa Fe, an institution that we know quite well here in Santa Fe, New Mexico, and also holds a PhD in political philosophy from Boston College. So with that, I will stop our screen share and welcoming you here for this bi-coastal conversation with me here in Malibu, California, and Dr. Eide back across the country in New Jersey, I believe, my homeland. And so let's begin, Dr. Eide, with introductory remarks from you, and then we'll engage together in conversation. Thanks so much for joining us.
Yes, well, thank you so much for having me to talk about this very important topic of homelessness. I regret that I can't be there in person. I try to get out to California as often as I can. Ordinarily, of course, these are not ordinary times, unfortunately. I don't have to tell you all, if you are all California-based, that homelessness is an important topic. I've researched a few different policy topics in my work in the think tank world. About 5 years ago, the big focus of my research was public pensions. I was out several times a year in California talking about California's public pension crisis. And every time I'd talk about pensions, I'd have to do a fair amount of introductory throat clearing. You say, well, you need to care about pensions because if you want these other functional government, if you want services, the money is all going to pensions and not those things that you want, et cetera, et cetera. Eventually people would get it, but as I say, it would take them a little time. You never have to do any type of introductory throat clearing when you're talking about homelessness in California and in New York and a number of other places right now in America. This comes through in all kinds of public opinion polls done by the San Francisco Chamber of Commerce, surveys of transit system users, customer satisfaction surveys done of the BART system, for example. If you think back to the distant time of early 2020 and Governor Newsom's State of the State speech, he devoted the whole thing to talking about homelessness. It also comes through, if we're going to get into kind of what the public, so, and clearly, and though now, COVID, both the health risk and the economic harm associated with the COVID shutdowns that's what everyone's at the top of everyone's list of concerns right now, but it hasn't completely eclipsed homelessness. Homelessness is still a high concern in polls, and there are important COVID tie-ins to the homeless challenge, as we'll talk about a little bit more later. It also comes through, Californians have been very, have registered their concern and their willingness to enact tax increases or spending increases to pay for homeless services. And there was Measure H in LA County in, I think it was 2017, Measure HHH, LA City, I get those mixed up sometime, but I think that's right. Big bond issuance to fund thousands of units of permanent supportive housing for the homeless. San Francisco Proposition C, hundreds of millions of dollars have been opened up to fund more homeless services in San Francisco. So the public is willing to spend more to address this challenge. Clearly, obviously not every tax increase ballot initiative passes in California, but in homelessness, they've been on kind of a winning streak. But the public is also concerned about the direction of things, how effective all this spending is, the direction that things are headed in. The homeless numbers in California and in major jurisdictions of California, San Francisco and LA, just continue to rise. In the most recent annual count of homelessness in America, outside California, it went down, but the total nationwide number registered an increase because California's increase offset the decrease elsewhere in America. To get into kind of what the nature of this problem, what California is up against, I think it's helpful to talk a little bit about the history and the geography of homelessness. As I kind of suggested in talking about the national situation, in most places in America, homelessness is a problem, but it's not really a crisis. Most places in America, this is not at the top of the public's concerns. I mean, in the presidential debates, presidential election, does homelessness come up? Well, sort of. I mean, President Trump took something of an interest in the situation in LA. Joe Biden, if you look at his policy agenda, he certainly has things about homelessness, but it's not really at the top of people's list. I've done a fair amount of research in Rust Belt cities, places like Youngstown, Ohio, Gary, Indiana, Flint, Michigan. These are places with really profound challenges. I mean, deep poverty. They haven't had very much good news in the economic development front for, like 50 years. But these are places that don't have a homelessness crisis. They have their homelessness is an issue, but it's not something that they spend tons and tons of money on because it's not, among their many other challenges, homelessness is not at the top of it. So somehow accounting for what California is up to does require accounting for that there are other places with probably worse challenges in California, but they don't have this challenge in exactly the same way. It's not too trivial to talk about climate when you're talking about homelessness. Sometimes people don't talk about climate because they think it's like too obvious, but it's actually a very important factor. The research bears this out. But basically, the thing about climate and homelessness is that places with very pleasant temperatures, in January especially, tend to have very high proportion of their homeless population on the streets. They have a high rate of unsheltered homelessness. In New York City, which has the largest homeless population of any city in America, over 90% of New York City's population is sheltered. Homelessness is a huge concern in New York City, but and we have this huge sprawling shelter system in which New York spends billions, in part because of this right to shelter that we have, which we can talk about later on if you guys are interested. But we only have 3,500 unsheltered homeless. That's a very small number relative to the scope of the challenge. Queens, New York, which has a population the size of Houston, only has like 100, 150 unsheltered homeless people, according to our annual street count. That's pretty small. So we have this big sheltered problem, not as large unsheltered problem. And if you look at places like Maine, Anchorage, Alaska, again, maybe the temperatures are nicer in the summer, but that doesn't mean that tent cities spring up all over these places. It's the cold temperatures in January that push down the street population. Again, it's an obvious thing, but sometimes people forget about it. California's great climate is in some ways a curse on this score. Getting in more into the history of the challenge, the problem we have now, scholars sometimes call it modern homelessness. Modern homelessness emerged in the early 80s. What we're dealing with now is pretty similar to the problem that emerged in the early 80s, and as we started debating now. We've always had homelessness in America. We didn't necessarily use that term, the term homelessness. Those terms were promoted, essentially invented by advocates in the late 1970s to push for more support for subsidized housing, as to essentially push back on the sort of retrenchment approach to domestic policy that the Reagan administration especially was taking in the early 1980s. That was the debate that was going on, and people pushed this word homelessness to advance their side of the debate, and it took off. And so by the mid 80s, everyone was talking about this homelessness problem, even though generations before we had talked about hobos, tramps, bums. These terms eventually fell out of use, but we were talking about a population of very poor single adult men who were detached or sort of standing at a remove from conventional society. Familyless men, placeless men. Sometimes people would use the term homeless, but more often they use these other terms like tramp and bum. It was a population, a cohort that kind of emerges in the post-Civil War era, and it went up and down over the generations. The peak era of homelessness in America is generally assumed to have been the Great Depression. The trough is usually thought to have been mid-century America, mid-20th century. That's the kind of Skid Row era. As of course, Skid Row is the name of a very well-known neighborhood in LA near downtown. But in mid-20th century, Skid Row was a lowercase name. It was a category of a neighborhood that many cities had a Skid Row neighborhood. Where's your Skid Row neighborhood? Oh, it's this place, that place. Like the Bowery in New York City, maybe was the most famous example. As a result of various urban renewal policies, Skid Row and housing regulation pushes, Skid Row kind of vanished from the scene, and as a result, the population that used to be concentrated in those neighborhoods, it was a neighborhood just for placeless or disaffiliated homeless men. That population was then spread out throughout the rest of the city, train stations, parks, libraries. That's the situation that we have today. So urban renewal was a big part of that. Also, in housing regulations, we also should talk about the mental illness aspect of modern homelessness, as it comes up all the time. Untreated serious mental illness defines for so many people the face, the countenance, the cast of the modern homelessness challenge. We don't have great data nationwide. We don't have great data of the quality we have now about the bums, tramps, and hobos in, say, like the 1920s. There weren't like nationwide counts done back then like there are now. But we do have some pretty high quality kind of one-off sociological studies of certain neighborhoods that academics would do in the 20s or 60s or whatever. And one interesting dog that didn't bark so much in those studies is mental illness. These are men who had big problems. They were physically broken down in many cases. Certainly alcoholism has always been a challenge, substance abuse, but not so much mental illness. That doesn't come up so much, in contrast now where it comes up all the time. The mentally ill prior to the 1950s were largely housed in mental institutions. They were called asylums when they first got going in the 19th century, later called hospitals, mental institutions. But that was a system that was set up in the late 19th century, and has a very bad reputation now, it's interesting to me the way the term asylum has tends to have very positive connotations in the immigration debate. It tends to have negative connotations in the mental health debate, but it was a very positive term when it first got going, and that was what people were trying to do for mentally ill Americans in the late 19th century, offer them kind of solace and a peaceful place away from the rigors of normal life. It had a lot of problems with it. There were a lot of scandals. The population just kept going up and up. They couldn't, it just was unmanageable, unwieldy. I don't want to go on too long about the asylum system, as interested as I am in it. There's a lot of mythology about it, but certainly there was a lot of scandals too. And so around about the 1950s, what we now call deinstitutionalization got going. At first it began that the institutionalized population peaked in America in 1956, around 560,000 people, and it started trending down in that decade. At first, we were releasing people who were not really mentally ill at all, sort of old, senile Americans who could be cared for in nursing homes. Also, antipsychotic drugs, the first antipsychotic drugs came online in the 1950s. So the hope was that kind of releasing a pressure valve from these institutions would actually improve the care of those institutions themselves. Then that transitioned to, well, let's just blow up the whole system, dynamite it. And so that's what we did. Deinstitutionalization really hits a flood in the 1970s. One reason for that were legal changes that made it very difficult to commit somebody against their will. In some cases, there were legislative changes. In California, the LPS Act in the late 1960s, signed into law by Governor Ronald Reagan. But in other jurisdictions, what happened through the courts was even more important. Also, an underappreciated factor in blowing up the old institutional system was Medicaid's financing. When Medicaid came online in the mid-1960s, we still had a large institutionalized population. The federal government said, we're not about to pick up the bill for half that. So the federal government said, we will pay for community medical services for mentally ill. We won't pay for institutionalized care. So that what's called the IMD exclusion, which is still in place to this day, incentivized states to put more people into the community where they could get the federal government to pick up the bill and reduce their institutionalized population. And eventually, so you found in the early 1980s a very large population of people on the streets with obvious untreated mental illness. I'm going to move on from this topic of mental illness later, but we can talk a little bit more in the discussion period about how large of that population is.
Right.
Moving off of mental illness, we talked about urban renewal. Let me get more into the present time, like right where we are now, to talk about COVID and solutions, to make sure I get to that. The COVID situation in when we go flashback to March, there was a lot of coverage about COVID and the potential implications for the homeless population. The long story short, it has not been as bad as people feared. Very reputable scholars in late March were predicting 3,500 deaths. It appears to be around 2,200 deaths now from COVID among America's homeless population. This is the good news. We should be glad about this. But the way that has played has been kind of caught up in the COVID debate in general, which tends to replace sometimes caution versus what a cautious thing to do versus what a scientific thing to do is. And secondly, debate about just wanting to secure as much funding for possible for homeless services. And if you want to do that, then you need to kind of exaggerate the challenges that the homeless populations are up against. But in general, COVID has been a good news story. I know I'm short on time with my intro, so let me leap really quickly into the solutions part of it. What everyone is interested in is housing. Isn't homelessness a housing problem? And if so, shouldn't we just be building more affordable housing for the homeless? Isn't it that simple? Homelessness, I certainly agree, is in large measure a housing challenge. If you want to talk about why a place like in the Midwest, which has lost 2/3 of its population since the 1950s, doesn't have a homeless crisis, well, it's a little bit easier to find at least cheap housing there than it is in San Francisco. But what people mean by affordable housing, subsidized housing, it doesn't have a big track record of success so far. These ballot initiatives that I talked about that have opened up so much money for homeless housing, it's been very difficult to bring those units back online. They're onerously expensive, $500,000, $600,000, $700,000 per unit. And so what we need in terms of the housing the homeless is to think more about what we might think of as a fix-it-first approach, just as with public infrastructure. Let's fix the system we have versus trying to expand services. There is low-rent housing out there that some people on the verge of homelessness rely on. Board and care facilities in California. We have these three-quarter facilities in New York City. We need to think more about how to support those types of systems instead of just trying to build new units for the homeless. We're just going to be chasing the dragon. We'll never catch up. The numbers are too large. And lastly, I think we need to do a lot more on the mental health front. It would be surprising to many people how little emphasis is placed on mental health reforms, things like assisted outpatient treatment within the countless strategic homeless plans that governments have been put up. I mean, task force after task force, all kinds of ideas. They don't actually talk as much about mental health reform as they should. There's a lot that could be done on that front. And lastly, we just really need to appreciate the diversity of the problem. Some people we are absolutely going to need to provide subsidized housing for the rest of their life. A lot more people, it's just more appropriate to think of a kind of temporary housing intervention. For some people that may be bare bones shelter. For other people it may be a little bit more transitional housing, service enhanced temporary housing. It's a question in my mind to what extent we really need homeless services systems at all. We need mental health services systems. We need school departments. We need unemployment assistance programs. Maybe we could let those various agencies control certain units for their population, but grouping all these very different kinds of problems together, substance abuse, mental illness, lack of low rent housing, single parent families as a big driver, homelessness, really clouds the debate and may also prevent a better approach towards solutions. There's a lot more to talk about. We can go in all kinds of different directions, but let me stop there with my introductory remarks and turn it back over to Dean Peterson.
Thanks so much, Stephen. It's a great table setter here. And again, we invite your questions in the audience. You can enter them through the chat feature. We'll get to those in due time. I wanted to just bring up a couple of questions just based on your initial remarks and our conversation we had last week in preparation for this, Stephen. One of the things that you've helped me understand, which again would seem to be an obvious question, but not being an expert myself on the policy issues around homelessness, is this question around policy goals, which of course is something that we teach and train here and educate here at the policy school, that it's not just about what you're doing, but why you're doing it. And it seemed that in some of the programs that you've covered, mostly at the city level, there seems to be either a confusion or even an argument over what the goals of homelessness policy should be, and be specific about that, whether they should be more rehabilitative in nature. Is the goal essentially to support those who are either on the edge of falling into homelessness, or those that maybe have been homeless and you're looking to reintegrate them into society, so to speak? Or is it more palliative, frankly? Are we looking to simply support those with services who are homeless without an explicit goal of rehabilitation? Tell us a little bit about what you're seeing around the debates around policy goals within homelessness policy.
It's a big problem at the moment because there's been such an increase in funding. So many social service agencies, nonprofits have seen their budgets grow expansively in these crisis jurisdictions. And yet there's a lot of question about how well they're doing. And some cases we're talking about waste, fraud, and abuse. But even when you're not talking about that, like, how do I know somebody is an excellent homeless service provider versus just like kind of a mediocre one? There's not a lot of consensus on that. In terms of goals, But generally speaking, when you're talking about homelessness policy, which is in some ways kind of segregated off from poverty policy more generally, you're talking about housing goals.
Mm.
In California, because it's been so hard to build housing, even when you have the money for it, where do you site it? What kind
Right.
of
That's
what
especially true
population is
here
it
in
for?
in Los Angeles and up in San
Yeah,
Francisco.
the
Mm.
people who are regarded as really serious about homelessness, the real, leading wonks, that's what they're kind of all about and what they're focused on. And all these governments embrace the goal of ending homelessness because they believe in this philosophy called housing first. They embraced that goal many, many years ago, and yet they haven't even been able to reduce homelessness. So they haven't proved to be very successful. But more generally, it's if you're viewed as doing the right thing if you're just trying to build as much housing as possible and trying to keep as many people housed for as long as possible. Goals such as increasing workforce participation, sobriety, achieving more mental stability for mentally ill people, reuniting people with their families and their communities, helping prisoners successfully re-enter into society. Let me put it to you this way. A homeless service provider could be essentially making almost no progress on any of those fronts, and yet be succeeded in keeping its clients housed and be regarded as a very, very successful homeless provider. I think we really need to have a little bit more focus than on those other goals than we do at the moment, because the conventional wisdom, just this incessant focus on housing, I mean, I'm not saying it's unimportant, but it really crowds out thinking about other kinds of goals and metrics.
There was a bracing set of pieces from the San Francisco Chronicle a few years ago, around 2016, in which they described the homelessness challenge in San Francisco and the Bay Area, and came up with a term that I'd never heard before called the homelessness industrial complex, which I found to be really rather interesting coming from the Chronicle. But they essentially discussed, and I think it goes back to this discussion around goals and how we are actually evaluating these, by and large, nonprofit organizations, but certainly governmental organizations as well. That rehabilitation and evaluation as to the effectiveness of these different organizations was not really described or understood very well. At the same time, billions and billions and billions of dollars were being spent by the city and county of San Francisco on these networks. Your thoughts then on maybe do you see this as an issue, especially in our larger cities, what the Chronicle calls this homelessness industrial complex? Is that a thing? And how might we think differently about how we not only spend public funds in working through nonprofits or even governmental entities on homelessness policy, but how we evaluate their performance?
Yeah, it's an issue that has interesting kind of political cross-cutting dynamics. Essentially the question is, and this is something that comes up in many areas of social policy, is what we need to do here redistribution or rehabilitation, meaning rehabilitation, training, therapy, helping people sort of improve their lives in certain ways, or do we just need to transfer resources to poor populations from people who have more resources? On the very far left of the homelessness debate, people believed in just redistribution, or redistribution is the overriding goal. The homeless population are basically, their greatest problem is that they lack housing, they're poor. If you give them housing, their lives will improve. We can work on other things too. We can talk about job training, whatever, later, but we really need to redistribute resources towards them. And that in those circles, you find a lot of criticism actually of the homeless industrial complex, even though the people who run the homeless services industrial complex, major agencies, are themselves almost all progressives or mostly progressives. And then on the political right, you find people who are just frustrated at the size of spending, larger and larger government without adequate results. And they criticize the homeless services industrial complex, less because they want a system of pure redistribution, but just because they think it's like essentially corrupt and wasteful. But it's a difficult position for people on the political right to be in, and they often, I think, don't grasp this, because if you do like the idea of, like, you know, I brought up the example of ex-offenders. So people, we want prisoners to re-enter society, we want to get them back on their feet. Does that mean we want to give them housing for the rest of their lives? Well, they don't really necessarily need that, but we certainly want to help them, you know, get commercial licenses, access opportunities. That's more of like a rehabilitative nature. That means we're going to need to fund community nonprofits. And so you do have to essentially defend something like the homeless services industrial complex if you want to avoid the position that, no, this is just about, you know, redistribution.
Well, and I think your point, what you just said, you took the words out of my mouth. In some ways, given the complexity of this issue, as you said in your opening remarks, there are a lot of different reasons why people become homeless, and in that, it's a policy problem that demands a great diversity of responses, which our nonprofit civil society world here in the United States really seems perfectly prepared to address. You know, we've got, and I'm, you know, there's a group called US Vets that works nationwide, and I know some folks working on that issue here in Los Angeles. US Vets just works on homelessness policy, especially for veterans. We have other ones that are working on kids. We have other ones that are working on mental health issues. So we need that diversity, that complex of nonprofits working on this set of issues, as opposed to these broad brush solutions. But I think what you're making a very good point of, and I've heard you describe it as well, is almost kind of like how we evaluate charter schools. How do we think about how we evaluate that, and the work around evaluation, which is being brought increasingly around charter schools and their performance, which is, again, an extra governmental delivery of a public service, in this case education, does not seem to be as much at play here. And that's where I think this homelessness industrial complex is riffing on this dynamic where self-serving organizations are essentially in for proving the need for their funding as opposed to their actual performance.
Yeah, and you know, with regard to the first point you make about the nonprofit sector being diverse, I mean, it's diverse, but it's government funding matters, and because nonprofits are in practice so dependent on the contracts that they get from government, and purely private charities are rare and just kind of small players, certainly in the homeless. They're not unimportant, and in some jurisdictions they're kind of the whole system. But when government decides to ask in return for those contracts will have a lot of influence and tends to have a flattening effect on the diversity of the nonprofit sector. But yeah, I think charter schools is the best model. You know, the thing about, you know, we agree on the basic way to evaluate them. They're a nonprofit. Their core funding is from the government contracts. They can raise extra money if they want to, but the core funding is from the government. And we, you know, maybe student test scores are not the end of the conversation about what constitutes a good charter school. If we're thinking about shutting down a charter school, we need to look at not just what their test scores are, but everyone agrees it's like at least a conversation starter. We don't even really have those conversation starters in the case of homeless services, and as a result, we just tend to have a very subjective. Our opinions about what quality means tend to be just very subjective. Whereas in the charter school world, it's, you know, it just, you can debate quality and you can debate the direction of educational policy in a just more kind of substantial way. than you can homeless policy. It also comes up, by the way, in the case of citing controversies, as we're one of the
Right.
most controversial issues in homeless policy. You've got a new facility you're trying to build. You got the money all lined up. You got the provider. The community is not thrilled about it. How do you work through that? A lot of times it's because, and if you talk to social service providers who have pushed through those citing controversies and developed workable relationships with their community, it's about the community getting to know them. And if we can have a better evaluation system, that might lend a little bit more. It at least might allow the citing debate to be conducted in a somewhat more informed manner than it tends to be.
I want to get to some of the really good questions we have coming in again through the chat feature. A question from Bob Nelson is about, we've been talking about some of the failures here in California. Are there places where you see, whether here in California or outside other municipalities by and large, or even states, that are exemplars of good homelessness policy? And what would you see as some of the contributing factors to that we might learn from?
Well, the thing about California is it does so many things on homeless policy that it's got to do something right. I mean, there's just so much homelessness policy in California. It's hard to compare with other places where the homeless population is small, because it's small because it never got large. Any place where it got large, New York, Seattle, San Francisco, they never really managed to bring it down again. I mean, this problem has really been with us since the early 80s. It hasn't changed that much. It's just gotten bigger. I think there are some things that California, when I talked about the fix it first approach, a lot of Californians understand that this housing is just crazily expensive. We've got to figure out a way to spend less than $700,000 on a unit of housing. And so this project that they're doing right now called Project Home Key, where Governor Newsom has secured $600 million, mostly from the federal government, to allow organizations to buy up properties and convert them to housing for the homeless. I'm not sure about some aspects of it, because some of these facilities seem too big. Housing for the homeless, I think, should generally be small facilities, but it's not an unreasonable idea. I mean, if you have this extra money that the federal government says you can use for this purpose, you've got some motel that is not going to have any tourists anytime soon. If you do have a reputable provider who can equip it with the proper services, this is exactly the kind of fix it first. And they say it's going to be a lot cheaper than the HHH program. So there are small things that California does that are sensible. The problem is that it's just the scope of the problem is just so large that it's not been able to make that much headway on actually reducing the problem. I mean, is California the worst state in America on poverty? I don't know. I mean, is it worse to be a poor person in San Francisco than in Flint, Michigan, or Gary, Indiana? I don't know. It might. I mean, certainly there's lots of philanthropic resources. So you can be a very bad place on homelessness, but not necessarily be the worst place on poverty. It's just worth thinking about in that respect.
This issue around, which has been another set of questions, and you raised it in your opening remarks, about mental illness and the deinstitutionalization, as you recite the history, which began in the 50s, continued through certainly into the 70s and early 80s. Several questions here about how we consider mental illness as it relates to homelessness, and whether our policy pendulum swung too far from institutionalizing those in a place that were, as you say, many instances of corruption, terrible treatment of those who were institutionalized, but the pendulum swinging to complete deinstitutionalization. Is there a part of this puzzle that would reconsider deinstitutionalization in such a way that could bring greater balance to this and in a way engage in the broader homelessness issue?
Yeah, I mean, I think as a result of deinstitutionalization, we did have to develop certain community services programs that we didn't have back in, prior to the 1950s that are good programs. Um, uh, Assisted outpatient treatment, what we have in New York called Kendra's Law, what in California is called Laura's Law, is a program. We use it a lot in New York, and
Hmm.
it has many studies have confirmed that this is a great program that really. So what assisted outpatient treatment is it's outpatient commitment. So people who've had a rocky history with untreated serious mental illness, incarceration, homelessness, but we think they can live in the community as long they're put into a court-ordered super treatment program. So they have to meet regularly with the judge, see how they're going with their treatment regimen. Um, they're not going to be thrown in jail if they don't comply. They're not even necessarily going to be put in a mental hospital if they're the criteria for institutionalizing someone in a mental hospital is going to be the same regardless of if they're in an assisted outpatient treatment program. But this kind of effect of just a more structured life, again, studies have shown in New York especially that this really is very helpful in stabilizing certain types of people. It's grossly underused in California. It's legal. The counties have to, the major decisions have to be made at the county level. The counties have not gone nearly as far as they should have. There's also always debate in California about conservatorship programs, which
Right.
would give someone kind of a broader scope of powers, less specific in nature than assisted outpatient treatment program. There too, this is a program that is really just kind of baby steps in terms of discussing what it, what it should be able to do. And then eventually, you do have to have some conversation about hospitalization because some people really need the kind of intensity that only the hospital environment can provide, and especially state public psychiatric hospitals. It's really many people are always surprised to hear that we've been cutting hospital. They think that we cut all our hospital beds back in the 1970s. We're still cutting hospital beds. We've never stopped doing it. We're doing it to this day. And so that to me seems like a case where the pendulum is swung too far. If we want to reduce the reduction in hospital beds, we might need to think about legal regulations on commitment. But the bigger issue, I think, is actually the financing one. If we allowed Medicaid to pay for inpatient hospitalization, if we got rid of this thing called the IMD exclusion, I think that would make states take another look at psychiatric care, inpatient psychiatric care. There's been some movement on that front in recent years, but we're still not where we need to be.
So, Stephen, you've also made the nexus, which I think sometimes we in the policy world we can get so siloed in our thinking that if we're not thinking differently around institutionalization in hospital environments, we stand ourselves to be in the place where we are now, where we are essentially institutionalizing some of these same people in prisons. And so there can be different levels of, I wouldn't say that we're picking one over the other, but I think you've made a very profound point around the question isn't institutionalization, it's what public institutions we will be responding to this challenge with.
Right. There's this kind of grim competition between LA County Jail and Cook County Jail over which of them is the largest mental institution in America. But they're, of course, jails, not mental hospitals. And every state in America, the largest mental institution is a jail. The number of mentally
Mm.
ill who are confined a larger number is going to be in the jails than in the mental hospitals. Yeah, I had a colleague, a late colleague. His name was DJ Jaffe. He passed away in August, unfortunately, but he was a big proponent of assisted outpatient treatment in particular. And when everyone said, well, doesn't that threaten someone's civil rights? It's like, well, the civil rights are going to be completely obliterated in jail. And It's even at this in recent years where we've seen jail populations decline. I mean, New York City, the Rikers Island complex, there were like 25,000 people in the early 1990s. Rikers population peaked under Dinkins. A lot of people don't know that. Mayor Dinkins, peak Rikers population. And it's now, before COVID, it was, 8,000 or lower, and it's lower still now. So it's just collapsed. But that number of people who are seriously mentally ill has just been very stubbornly high.
Mm.
That the general reduction and use of jails accompanying the crime decline has not been as reflected in the mentally. It's been very hard to get down, and not that people haven't been trying. We have an array of diversion programs. We need to be doing more diversion programs. It's true, but it's been a really tough conundrum trying, if you're just working on criminal justice reform, to reduce the rate of mental illness. You got to think more about mental health reform if you're going to reduce the rate of mentally ill people behind bars, it would seem.
How much work, Stephen, have you done? I have seen some studies recently regarding for lack of a better term, the triggering mechanism that homelessness can be to actually move people into mental illness. This something that would happen where, usually for financial reasons, somebody becomes homeless, but then because of the homeless experience, we then begin to see mental health issues. How much of this, what seems to be a vicious cycle, do you see as playing a role in making this a difficult policy issue? Or how much of that is really just a small subset, and these other issues, whether it's coming out of incarceration or existing mental health or substance abuse issues, are really more of a contributing factor to the problems?
Well, this gets into why we probably will never know what the rate of mental illness is amongst the homeless population, because we can't really agree on what mental illness itself is. If you're talking about something like schizophrenia, which is something that develops on its own in late teen, early adult years, has this biological component to it. That's a cause that will, that's going to make it difficult for someone to, it's a disability. It's going to make it difficult probably for you to hold down a job, so you have no income, and it's hard to share housing with somebody with schizophrenia often. Certainly life on the streets can exacerbate underlying mental illnesses. It can lead, people talk a lot about the term, I'm not entirely comfortable with the term trauma because it's just such a catch-all term. It's not entirely clear what anyone is talking about when they're talking about trauma. But certainly life on the streets for many years changes you and will make it difficult for you to reintegrate back into a normal community setting. So mild mental disorders certainly can contribute to homelessness. If someone is a hoarder, that could make it very difficult for them to live with. That hoarding is not as serious as schizophrenia, but it might be serious enough to contribute, along with these other factors, like living in California as opposed to Flint. It does happen on both ends. It can be a cause and effect, but it does complicate ultimately, whether or not our ability to say exactly. So how many are mentally ill?
This also is a theme of several of the other questions here from our audience around this, the mental health issue versus the housing first issue. As you've said, that really seems to be California's approach. Certainly here in Los Angeles, Project Room Key, as well as these bond issues where hundreds of millions of dollars have been approved. But in each place where a housing development has been cited, it really has been an excruciating process to get a shovel stuck in the ground. If you were to say be the head of homelessness policy here in California, would you be that? as opposed to being more at a city level and say, pick your city, LA, San Diego, San Francisco, or the largest cities here. And B, what would be your first priority of the different parts of the contributing set of factors into homelessness that you would try to engage with first? Would it be mental illness? Would it be substance abuse? Would it be vets? Would it be, those coming out of correctional facilities?
Mental illness would be the first thing for me. I do a lot of research on mental illness. I just find it so frustrating. The amount of money we spend on mental health. California, you have this Mental Health Services Act, just billions and billions, and it just never seems to get any better. But on the housing, there are certainly housing. The problem with Housing First is that it's just way too doctrinaire and way too top down in the way that it's applied. It's a state requirement. It's a requirement of state law in California. Right. Programs that are state funded have to comply with Housing First. The federal government's continuum of care program, Housing First, is essentially a requirement. And this has crowded out certain types of other options that used to be that either by neglect or because by cutting their funding, that used to be an appropriate a part of the homeless services system. I mentioned transitional housing is this model that's in between emergency shelter and permanent support. Permanent supportive housing, you have it for the rest of your life. Emergency shelter is just a place to stay to help you get back on your feet. We're really trying to move you out in weeks or months at most. Transitional housing, you're in a program. And we're going to give you these services. We're going to target a goal, employment, finding a roommate, finding your own place. The number of transitional housing units has just collapsed nationwide over the past 5-10 years as a result of all the focus on Housing First and permanent supportive housing. And so again, for certain cohorts, I mentioned ex-offenders, that's bad for them. They're kind of left out. These board and care models, these small facilities that are they're kind of like mom and pop operations. Amidst all this focus on homelessness in California over the past 5-10 years, hundreds, maybe thousands of board and care beds have been lost in California. Some of these, are not very attractive. They're not run by prestigious social service agencies, but for some people who relied on them, the loss of these units is a big threat. Sometimes, sometimes it is a problem that you're letting the perfect be the enemy of the good or adequate, because how else could you explain how so much money can go towards such modest results?
So your thoughts then about how budgets are being allocated. Let's go back to the East Coast where you are and look at New York City. You said that there are a couple programs that make sense and others that are just getting really focused on funding as opposed to deliverables or policy. Are there things that Los Angeles can learn from New York or San Francisco can learn from New York?
Well, the programs that have not gone all the way on Housing First requires it's really about permanent housing, but it's also throughout your whole homeless service system. They really don't want you to set up programs that somehow require sobriety or participation in services or work programs in exchange for the receipt of housing. So that means what's called low demand, because we want everybody just to come in off the streets. We don't want to create any barriers. Well, the problem is that you do have some people who are really motivated to try to get their lives back together. They're teetering. If you can put them in an environment with other guys that really want to get their lives back together, maybe you can kind of build a brotherhood. And you're giving them services and stuff. There are social workers around, but really the important thing is that you create these little communities that kind of support themselves, support each other, and that can't happen if somebody is actively using and he has just as much a right to be there as everybody else.
Interesting.
So you have, programs like in New York City, there's a high-profile program called the Doe Fund, which has been around for a number of decades, and that's
Hmm.
the type of cohort that they work for. They don't work with seriously mentally ill people, but you are required to submit to drug testing, and they have a program that they put guys through, job training. They contract with other community organizations to do
For
uh,
janitorial services and things of that.
right. So you're earning a paycheck
Yeah.
immediately. It's not
Yeah.
glamorous, but you're earning money as soon as you start working. And, hopefully you can meet a roommate through this program and
Yeah.
eventually trying to move you out more towards a condition of self-sufficiency. So those are the type of programs that there's some of them that are still around, but sometimes they have to do some really fancy footwork to make sure that they have enough funding. And it's harder for them to expand now when all the focus is on just maximizing the amount of permanent supportive housing built in the Housing First model.
Stephen, we're in our last 5 minutes here together. And again, I want to thank you for really a terrific and important, obviously, and relevant conversation here. Maybe in our last few minutes, as we continue to live through just these historic times with the pandemic, such great polarization, obviously, an increasingly prominent homelessness crisis here in California. Is there anything that you can, I see from our audience, we're predominantly Californian, although I see we have folks from all over the country. Is there anything that we can have hope in?
Well, I see more change. I don't know about hope, but I
Yeah.
certainly see more change coming. I mean, if you look at what if, I don't know who's going to win the election, the presidential election, but
Right.
were President Trump to win, he would certainly look towards making more changes of homeless policy at the federal level. That could be important. If Joe Biden has a very ambitious housing program, I don't know if he'll get funding for it.
Mm.
Not just on homelessness, but also just affordable housing in generally. In some ways, it could be like a big bailout of places like California that spend so much money on homeless services. The federal government will kind of come in and just either top that off or maybe even replace it. So I see a lot, even if, regardless of what happens with COVID, and with COVID, the uncertainty is so great anyway.
Yeah.
Not least the uncertainty for state and local budgets, which are the largest source of homeless funding across the nation. But I think that 2020 has thrown a lot at us, but I think there could be more coming at us in 2021. And for that reason alone, I don't think the problem is going to become boring or go away. There's still going to be a lot to talk about and follow it homelessness policy in the next year or so.
Well, and you're right, and this goes back to your earliest remarks that the discussion around a topic like municipal pensions, which I share a deep concern as you do on that topic, does take for the broader public some setting up, some framing around the importance of this issue and how it involves them. Homelessness is very much of a different policy, and as we often teach here at the policy school, sometimes there are issues whose time has come. And it does take, for all of the possible reforms that we might be talking about, they do need to be sustained by public opinion and public engagement, frankly, whether it's the citing of homelessness shelters or thinking differently around mental health hospitals and institutionalization. And I think it's fair to say that now versus maybe even 5 years ago, the prominence of homelessness as a policy issue, particularly here in California, is one that at least sets a foundation for reform.
Yeah, and it's possible some good things can come. I mean, at the end of Obama's years, there were some interesting developments, bipartisan, on the mental health front, and it's conceivable that some promising developments could come out of could be coming as well, regardless of on the mental health front, especially regardless of who wins.
Dr. Stephen Eide, thank you so much from the Manhattan Institute. It's been a real pleasure having you here in this policy conversation. Again, thanks for all of you for joining us here. Within 24 hours, you'll be receiving a link to today's conversation. We ask you that you share it. I think that really it's an important way to promote this good thinking around a vital public policy issue. So again, thank you for joining us today, and stay tuned for the next one. But again, Stephen, thanks so much for your time with us today.
My pleasure. Sorry I couldn't be there in person.
Next time.
Yeah.
Next time. Take care all.